First, we're going to have our co-collaborator in crime, Fawad Akbari, is going to introduce a little interactive activity that we have. And for our panel today, we have, let me say, our presentations today. I'll introduce our guests. First we'll have a presentation of the landscaping on innovative finance for children and families in crisis, done through Moving Minds Alliance. Then we're going to have a few examples of real work on the ground. We're going to have Charlotte Badenoch from COAS Advisory Services. They do caring finance. And they're doing some fantastic things around refugee impact bonds, humanitarian, care economy in Asia. Very exciting work that she's going to share with us. We have Open Capital, who is actually a Hilton grantee, but sadly their representative was called out for a family emergency and had to fly out of the country. But we have some slides, so I won't do them justice, but I want to share with you the slides that they have. Fascinating work where they're working at the nexus of early childhood, refugee lens, and agribusiness. So a really innovative work that they're doing. And then we're going to have Arif Naki, who is the deputy chairman of the Africa Venture Philanthropy Alliance, and who is the founder of the UN SDG Sustainable Partnership Platform. He'll be sharing with us some of the pioneering work that they've done and some exciting new innovations that they have coming out. We'll also have Alvin Onango, who is engaged with KCA University as well as engaged with Rockefeller, who'll be sharing some call to action around innovative finance. And we have other guests with us. We have Andrew Richter from Agrofinance, who's doing some really interesting and innovative work around impact in agribusiness in East Africa. And through the African Venture Philanthropy Alliance meeting last week is considering putting a child lens into this work. So may have some very interesting reflections to share. And we also have Nora van Wintersdorf. You're going to correct me if I've pronounced it incorrectly. And she is from Alpha Mundi Group and Alpha Mundi Foundation. Very interesting group that's doing work around refugee lens investing, climate, small and medium enterprise, and gender lens. And very interestingly, her director shared with me that their global director is very interested in early childhood in the South Africa context. So a really interesting mix of actors that we have today. And we will be coming at this, there'll be this is a mix of many sectors, so there'll be new things for all of us. So at the end, feel free to bring up any questions and thoughts and reflections that you might have. I'm going to turn it over to Fawad.
My intervention will be quick and simple. So each of you should have one of these sheets. We call it walking, talking. The idea here is that as we go through the next panel, so think about these questions and note your ideas. And at the end, we hope that we will have about 5 to 7 minutes after the panel to come to you and ask you to stand up and walk around the room and talk. Find someone else who have similar ideas as yours. There are 5 questions. We need more time for this. But for that 5 minutes, you can focus on question number 3, how this conversation that we have about innovative financing is going to be relevant or is relevant to your organization work. But feel free to document your notes. In the worst case scenario, if we run overtime and we can't do the walking, talking, we will collect this from you, and then Katie will take care of that in terms of aggregating them into the report for the annual meeting. Back to you.
Thank you so much. So on these sheets, feel free to fill it out while you're listening. When you get a thought, fill it out. We'll also have a moment after Alvin speaks to just have like a moment of silence to do any more thinking that you'd like to do on your sheets. Thank you so much, Fawad. So we're going to begin with landscaping on innovative finance to address children and families in crisis. And for those of you who are coming to Moving Minds for the first time, the mission of this alliance is to scale up the financing, the policies, and the leadership to effectively support young children and families affected by displacement. Thank you, Andrea. Yes, crisis and displacement. So here's sort of a quite artistic and beautiful diagram around the systems change process. I will move quite quickly so that we have time for all the presenters. And really what we are looking at today, the landscaping takes a wide angle lens. Firstly, looking at children, we know that 0 to 8, the role of early brain development affects GDP for the next 55 years. So we know that 0 to 8 has a very strong, important focus, but we're also taking a wide angle lens and understanding that parents are children of ages across the age spectrum. We're also taking a wide angle lens around family. Of course, this means parents, but often it's elder sisters, it's aunties, it's grandparents who are caring for children. So we're really looking at the wide angle lens. And the landscaping looks at crisis and fragility. We'll look more into this, but both pockets of fragility as well as acute emergency. And then innovative finance, looking at the universe of innovative finance interventions. So a few of the findings that have come out of the landscaping. Children, when we're looking at children in crisis, caregivers and family are at the crosshairs of that. When you invest in parents and caregivers, you are investing in the child. So this may be really relevant to some of us who are working with Gender Lens or SMEs. We should look across the continuum of crisis, knowing that crisis is flexible. You can move back and forth from stability to crisis. There's importance around really targeting the subnational and local, knowing that today our focus has really been on localization. And we see that innovative finance necessitates the different sectors working together. We find that in most of the interventions, private sector needs to be part of that picture. And that entails getting different actors together who may not have traditionally worked together. But we also find that philanthropy plays an indispensable role on the enabling capacity of these types of interventions. And even in places like, for instance, Promise Ventures and Parenthood Ventures in developed country context, it's been very difficult to get at-market returns with early childhood. So philanthropy can have an enabling role to other sort of multifaceted and multi-layered interventions. We find that the scale of effort needed to change mindsets is considerable. If you just put people together, they don't understand one another. Not only they don't have different acronyms and different terminologies, but they don't understand one another's business operating model or their constraints. And so if you don't invest heavily at the outset, those collaborations can just fall apart. So the more you invest in really building trust at the outset, you're more likely to have a successful intervention. Sometimes in the impact world, we talk about falling in love with the problem, not the solution. I would say falling in love with how to solve the problem, not the specific solution, so that we are open and agnostic to all the kinds of solutions. And we also see that modeling the business case is needed in a lot of these things. Sometimes, skills and capacities that you might not see in the average NGO type environment, but business modeling may be very necessary to ensure that an intervention is successful. A few other things. There's a lot of entry points that we'll look across later, different ways of entering into the funding flows. We also look at different types of areas that are ripe for opportunity. I think we'll get into these a little later in the presentation. And we also find that there's an ability to bring in different non-traditional actors. For instance, pension funds, as we're discussing, insurance. These often have the life cycle of the child. And so there's a kind of synergy in bringing in these different types of different actors, faith-based actors, of course, local finance, international governmental organizations, philanthropy. And in one study that Convergence, that works on blended finance, did, they found that in about 110 blended finance interactions, only 20 focused on the child. But what they found is that they were one-off interventions. When someone was willing to take a risk, they did it once, but they didn't try it again. And so this speaks of the need for a track record, really building a track record that when innovative finance interactions are done, that they're successful, so it encourages repeat investors. So if we look into the state of the world, we were just having some conversations at the lunch hour about how the world's in a very interesting and particular state these days. In 2017, we had 535 million children. That's 1/4 of the world's children who were living in countries affected by crisis and disaster. By 2024, 300 million people were in need of humanitarian assistance. And by 2030, almost 60% of the world's poor will live in places affected by fragility. And by 2050, 1.2 billion people could be displaced. So we've really got a scale of problem that the globe hasn't actually seen before. In terms of children, there's 1 billion children right now who don't have good access to health, education, nutrition, sanitation, safe water. This is a little shocking to me. 9 billion more babies will be born over the course of this century. And those children will bear 90% of the disease burden caused by the climate crisis. And we will have 1.2 billion people eligible for a job in the next coming years. One of our colleagues, Frank Aswani, always talks about each month, each year, how Africa is producing secondary school graduates and youth are coming onto the market. And there's, I think, what is it? Arif, you can correct me. I think it's like a $400,000 job deficit each month in terms of new people needing jobs each year. You'll correct me on the numbers when you come up here. And so we've got people coming out with, we have more secondary school graduates than we've ever had on the globe's face of the earth, but they're coming into a market where they won't get jobs. And the World Bank director is quite, insightful. He talks about how if you think things are bad now, imagine when we have a huge group of people coming into the market and they don't find jobs, they don't find a place for themselves. The social unrest will be quite, large. Then, if we look at trends with families and caregivers, we see that women, mostly, are doing care for children, elderly and disabled people, that is equivalent to 16.4 billion hours a day. And if you put that into GDP dollars, that would be 10 trillion to the global economy that's not accounted for. On the other hand, if we look at men, 43% of men in the developing world do not engage in kind of interaction, engaged stimulation with children. And if they did, when a father does that, it has the ability to lift a child 1 quintile out of poverty. That means like from extremely poor to very poor, or poor to low and middle income. So as our whole sector in impact is talking about gender lens investing, we're getting women into the workplace and into the marketplace, but no one has gone home. And there's also a similar need to enable men to have the space to get into caring, to have the social, the social norms, especially in a low resource context. If you don't provide for your family, you're not a father. So helping to expand the definition of fathering beyond just providing. So if we look at finance, this number changes every day in terms of the number needed, 4 trillion and above, to achieve the SDGs. Traditional sources of aid are drying up. We talked about this morning about elections resulting in less bilateral aid, overwhelmed demand on philanthropy. And we're seeing a growing openness to new models of economics, finance, and business, where impact investing has experienced a 15.1 annual growth rate in the recent years. And they project that impact investing will eclipse traditional aid by 10 times in the next decade. This is a continuum. In certain circles, we often talk about the continuum of financing. So on this left side, we have conventional commercial investing. And on the other side, we have humanitarian aid and charity, religious giving, conventional philanthropy, just pure grant making. And we see that a lot of organizations, especially in the philanthropy sector, are looking at how to go across to do blended finance with DFIs, like development finance institutions, engaging in venture philanthropy, which is using venture capital techniques to do philanthropic work, catalytic finance, which is putting in money that raises larger amounts of money on the markets. We have impact-first investing, which is where it's getting a return, but you care about the impact more than the profit. We have finance-first, where you're doing impact investing and you want an impact, but you are looking at your return as your first priority, to conventional. So we see this a much greater play across this continuum, particularly in the philanthropy world than we saw, in previous decades. Up here we have a continuum of crisis. Stable contexts versus acute emergency. Gaza would be an acute emergency. But then you have a protracted crisis. Like we spoke of, our colleagues have lived in Kakuma or in a refugee camp for 15 years. We also have intermittent recurring emergency, like for instance Ethiopia. We've got hotspots of crisis in a context that's stabilizing. We have post-conflict, and then you have pockets of fragility in a stable context, like Venezuelan migrants in Colombia. So this continuum is very fluid. And if you were doing an intervention, you may go across these areas. And there's a way to think about mapping what kind of finance is appropriate for what kind of context. But it's not like straight up and down, right? Both sides, the continuum is moving, and we've got to be flexible, but we can think about what can be applicable in what kind of situations. So what is innovative finance? It's a range of approaches that address global and social and environmental challenges that differs from traditional donor-funded grants. So here is a whole universe of different financing types. If you want to dig into this, in the landscaping, it defines what each one is, and it gives an example, when available, when it's been applied in a child-focused context. But it covers everything from like the macro to the micro. Macro would be debt swaps. Debt swap would be, like we heard about, Kenya servicing 60% debt. So they may sell the debt on a market with a guarantee, so they're paying less in the interest rate. And then the savings that they get from that, they can apply to social sector services. That's the macro. And then you have micro, like time banking and match trading, where people in a refugee camp, they both don't have money, but if I'm a carpenter and Ghassan is a therapist, I can build a table for him and he can give me PTSD support. So it's trading without money. So we have both levels. We also have things that are used quite frequently as well as quite rarely. Like we have outcomes financing. Both Arif and Charlotte will talk about outcomes financing. And we're seeing a large uptick of this. Whereas something like levies, there's talk of like a levy on an airport tax. Every time you travel, something is given to children. So those would be very, more political and need more lobbying and less common. So you can dig into this when you want to kind of educate yourself by going into the landscaping. And when we look at the gaps and challenges and barriers in terms of the context of working in a crisis situation, there are a lot of gaps. We've got dwindling resources for aid, difficulty in reaching last mile locations, sometimes limited evidence. The systems in unstable contexts are often not resilient to shock. Often there's fragmented coordination. And then unstable contexts limit the kinds of instruments that are viable, financing instruments that are viable in that context. And then sometimes, in some cases, it's difficult to apply a market-based solution in a very unstable context. We also have other gaps and barriers across the board in innovative finance. One is around approaches. Sometimes short-term focus when a financing instrument needs a short-term return. That may not favor the long-term gains that are invested through early childhood. Usually you need like a 15-year return when you invest in that child till that child comes into the labor market. Oftentimes alternative financing doesn't consider children, families, and caregivers. Andrea was just mentioning to me that, like in many of these spaces, the child lens is like unheard of. It's not talked about. There's a target when challenging the most vulnerable, and sometimes there are philosophical barriers. That some may say that, it's not. This should be a public good. If we look at the operating model. Humanitarian operating models are often not built for blended finance or social enterprise. Acumen talks about when they're working with refugee lens, their humanitarian donors want to see like number of refugees. They want the same kind of outputs and outcomes that they would see in traditional humanitarian work, and it may be a different context. For collaboration, we see need for better methods to connect the global actors with the local actors. As in this morning, it may be difficult for GIZ to engage directly with a refugee-led organization. So what are the intermediaries that we need in order to make that possible? Under financing, it's often a challenge to bring innovative finance to the education sector. Market-driven solutions are not always appropriate. And in terms of results, a few of the challenges are reaching at-market return on early childhood investments, and concern about impact washing with children. That's like whitewashing or greenwashing when you say it's impacting children and you're overstating what it's really doing. So from all of this, we really, the landscaping looked across all kinds of actors. Foundations, venture capitalists, NGOs, refugee-led organizations, all types of different perspectives. And we found that there was a real need for awareness raising. Sometimes there's not an eye-to-eye seeing across mindsets. Sometimes in the financing world, the risk about going into crisis context may be larger than the actual risk, so a need for studies to break down what's viable. The need for patient capital, meaning investors who are willing to wait longer to get that money back. Building demand from the capital allocators' interest in this area. Also, our activities are sometimes really complex. At the lunch table, we were talking about layering mental health, on top of, like a lot of holistic interventions are not so clear-cut, and so helping investors understand that and be willing to stomach complex investments, and then moving into systems change approaches. It's very interesting that there are some common perceptions that you all might have experienced. Like in the finance sector, people like child lens, what's that? Like, is that charity? Or I even got this last week at the African Venture Philanthropy Alliance, like, oh, let me refer you to my grant making department. It's seen as charitable work and not viable in the business sense. Crisis, some don't have the stomach for that. In the development sector, there is a perception like, oh, they're for profit, you can't trust them, they're out to make money. And we see that in the green you have sort of in stakeholders' words, one stakeholder says, we are married entities. It's a for-profit and a non-profit in one sort of entity. But the NGO side doesn't trust us. They think you're here to make money. In the civil society side, sometimes in the NGO world, there may be a perception like innovative finance. Oh, okay, that's a way to make more money for my NGO. And so it's not that. It's a whole different operating model. And the perception that early childhood and for-profit cannot be mixed. So here, there's a lot of lessons learned that we can dig into matching the operating model to the context, considering non-traditional actors, using philanthropic engagement as strategic to leverage in other types of capital, working incrementally and engaging the right champions. Many actors found that you needed to engage like the CEO or the leader of something to make something work, when it was really, it was things that when organizations had not worked together before. Entry points, this is very relevant. There are, a lot of ways to enter into bringing together children in crisis. Care economy, migration and refugee lens investing, enterprise and employment. There's a natural marriage with care economy there, and that SMEs need, all these studies around how when women have care, they can, pick 35 more pounds of tea. In one case, they found that they made 90% more income than they did before when they had care. Agriculture, which we can delve into a little bit later. Nutrition, water, health. Peace finance, a very niche but a very fascinating area, engaging youth. And then we also see that there's entry points to work with different kinds of actors. Insurance companies. Emma might be able to shed light with us around parametric climate insurance. There's also Blue Cross Foundation that's funding outcomes financing in Spartanville, North Carolina. And all these different types of actors, including the ones we might think of less, faith-based actors, diaspora investors. So these areas that are particularly ripe, localization, working at the local level, using the family as the entry point to the child, thinking about financial inclusion and economic development, like micro-lending. How can we wrap child development around that, and parenting and childcare? Refugee lens investing, we have Alpha Mundi, who has very interesting things to share, as well as Open Capital. Gender lens investing, how can we put a child lens, a child angle on gender lens investment now that it's become so huge and mainstreamed across impact investing? Child lens investing. And climate. There's a massive amount of flow of funds globally into climate, and even many philanthropies are shifting strategies to move funds that were in other sectors into climate. And so how can we think about the child and the family within that and put like a child sidecar on climate funds, on a train that's already moving? Around potential collaboration, there are a number of actors that are members of Moving Minds who are actually already doing innovative finance. Often the person who's in this room is not the person in that organization who's doing that, but the entities are doing that. How can we build on that and that as an anchor? Through the process of the landscaping, a whole number of actors arose who would be interested in going deeper or collaborating in different ways on this area. So how can we make use of that and be proactive around that? These types, we had planned a work planning session for tomorrow. So these are the types of issues that we'd look a lot more when we get together as a small group and look at action planning. And in terms of potential lines of action for the Alliance, one is a learning journey for our MMA members. Some like may feel like this is interesting and cool, I'm curious, but I don't know a lot about this. We may want to educate ourselves. There are also other actors who've pioneered this and have a lot to share with us and can help us avoid mistakes. Other actions are awareness raising around innovative finance among child development actors so that they're prepared to come to the table and have the conversation with other ecosystem actors. And this is a key one, maybe one of the prioritized actions, awareness raising among capital allocators. That those, like Andrew said when we were in the meeting last week, he's like, all the fund managers are in the room next door. They're not getting this information and they're not hearing this story. So how can we make this more part of the agenda among capital allocator, global moments and events? There's also a potential for Moving Minds to serve as a connective tissue and bring actors together. And then the opportunity to explore potential engagement in doing something in innovative finance. This is an alliance, this isn't a funding mechanism, but the members in MMA do have funding mechanisms. We do have groups that are actively engaged. So how do we use, core anchor members with the strategic sort of strengths that we have to look at what's possible? So I'm sorry I spoke quickly. I wanted to make sure we have enough time for our other presenters. So I'm now going to ask Charlotte to come up from COIS. So I will turn.
Thank you for having me here. Really, really nice to be part of this group and hopefully walk you through some examples from our experience. Let me get to my slides and I can introduce myself. So I'm Charlotte from COIS. So COIS, we're an advisory and impact finance firm. So we have two major arms. On the one side, we manage impact investing funds in Europe and in India and in Asia. And then on the other side, we have our advisory arm, which is where I sit. And this is where we design, structure, and launch different types of innovative finance mechanism. And I have had the personal pleasure of working with a few people in this room to actually launch a development impact bond last year as well. We work across a number of different spaces and sectors in healthcare, livelihoods, climate, gender, and humanitarian contexts, which is what I'll speak to in more depth today. And we really try and work across the intersection of these different sectors as well, understanding the interconnectedness and interrelatedness of all of these sectors. We work across a number of different markets. I'm based here in Nairobi and lead our work across East Africa and across Sub-Saharan Africa. And as you can see, our work in Africa is actually the largest share of the work at COIS. We also have offices in Europe looking at impact finance in emerged markets, as well as in India, which covers the Asia region. Again, similarly looking at how we can deploy innovative finance to drive deeper impact across our work. We've worked across a number of different types of projects with different types of organizations. What we like to do is really work closely with non-traditional asset managers in particular, trying to think about how can we use capital differently to drive deeper impact, address critical funding gaps, and really innovate in this space ultimately. As we all know, and as Katie already mentioned, there's a huge gap in the financing available for the SDGs. So we do need to start thinking about how can we tap into that private capital and investment capital that dominates the market. It's 99% of assets under management sit in that space. Only 1% really sits in this grant capital space, which we are all, really dependent on for impact. So that's where we come in, really trying to think about how we design instruments that can bring in new types of capital to grow the total amount of capital available for impact. As you can see, we worked with a wide range of organizations, NGOs, UN entities, corporates, all with the same goal of thinking about finance differently to drive deeper impact. Again, we also have our impact funds, as I've mentioned, and have around $500 million under management through those, all going for impact outcomes, going towards impact outcomes as well. I'll speak a little bit now, and I know Katie's already set the scene, so I won't necessarily go into it in too much depth, but I want to speak about what innovative finance is. And I don't know maybe I'll do a raise of hands. Before today, how many of you have come across or have some sense of understanding of innovative finance? Okay, so we've got a good amount here. This is good. But hopefully I won't go all over everyone else's heads. So there are a really wide range of instruments that can be deployed and that fall under this umbrella. We typically use the convergence definition and cluster them into four main areas. At the earliest stage and potentially highest impact and lowest return stage, we have concessional funding and support mechanisms. So these can fall into areas such as design grants, technical assistance, as we have already been speaking to and as Fawad mentioned earlier. In the concessional funding space, this is where we're thinking of how do we move traditional grants potentially into slightly more innovative instruments, but still build on the core principles of grant funding. So we see things such as recoverable grants, concessional debt, zero interest loans, etc. So these are more concessional than your traditional finance instruments, but they're more commercial typically than your traditional grants. We then have results-based finance, which I'll speak a lot more to today. And this is where we're tying finance to results and outcomes. So it's very different in terms of philosophy to most grants in the market, which are input-based. So you're being financed based on activities and inputs that you're designing upfront. Whereas results-based finance really thinks about what the outcome is and the impact achieved and provides the finance based on that. Then we have risk mitigation instruments, and this is really thinking about how do we incentivize and attract different types of capital into higher risk or higher perceived risk markets. I'll quickly speak to some of the instruments we've launched. There's a lot of text here, so don't worry about reading it all. I'll make sure that these are available. Across three main buckets of mechanism, we've launched and designed a number of different types of instruments in humanitarian contexts. So in results-based financing, we helped design and launch the Refugee Impact Bond in Jordan. We're now looking to scale that into Lebanon and also expand it within Jordan as well. This was in partnership with the Near East Foundation and IKEA Foundation are the core outcome funder, alongside Novo Nordisk and NORAD. And then we brought in investment capital from US DFC, the US Development Finance Institute, and FIRD, which is a Nordic finance private investor as well. And this was really to invest financing into livelihoods outcomes in humanitarian contexts. It's been highly successful, hence we're now focusing on scaling that up, and has been a great way to leverage results-based financing in more complex settings and focusing on these results and outcomes. The second results-based financing instrument is the ICRC Humanitarian Impact Bond, which is focused on challenging markets and providing finance for physical rehabilitation of individuals and predominantly children who have suffered from conflicts. This is actually the largest impact bond to date at $27 million and is ongoing and is really focused, as I mentioned, on outcomes for physical rehabilitation for particularly children in humanitarian settings and conflict-affected settings. The final one is one that we are just designing at the moment, which I'm personally very excited about. It's the Humanitarian Development Peace Outcomes Fund. So we're trying to build now on some of these impact bonds and take them to scale and think about a larger financing mechanism that can operate in more fragile settings where it's harder to get investment capital and to drive outcomes in those settings. And I'm sorry if this, put your hands up if I'm making no sense here and I'm going too fast. I'm conscious of time though as well. There are two main sort of windows of financing that we're looking at for this. Actually, I'll move to a diagram here. We're looking at a payment by results window, which is typically what we're going to be using for NGOs and typical service providers and nonprofits in these settings to try and think about how we can build the ecosystem for businesses and longer term projects for impact. We're still designing what the theory of change is for this and the focus areas. And then the second area is thinking about how do we support financing for market-based solutions and businesses in these contexts as well. And we're looking to do this through impact-linked loans. So the aim for this whole outcomes fund is to work at that intersection across the triple nexus, humanitarian, development, and peace. Often overlooked, we see a lot of crisis funding, but less longer-term funding as well. So we're trying to address that through this, and similarly look at financing more innovative interventions that drive longer-term impact and are based on results rather than immediate crisis prevention. I am conscious of time, so I'll probably start wrapping up on this. The real aim here was to showcase that while complex and humanitarian contexts are complex, There are innovative finance mechanisms that can be used and have been used very effectively within these. I haven't touched on the two others yet, but we have also looked at impact funds, impact investing funds. There was one with WFP looking at food security that we've been designing with their innovative innovation accelerator. And then also blended finance facilities, thinking about longer term investments in infrastructure in harder to reach settings and more fragile contexts, thinking about how we invest in green infrastructure, longer term solutions, etc. So this was through a number of interventions here in the wash and solar energy space. I'm going to stop there, as I know that time is not on my side, but very happy to follow up on this with anyone who's interested. Thanks very much.
The work they are doing is, pioneering, globally very innovative. So thank you guys for taking risks that others have not taken. So that was wonderful. Our next presentation, is from Open Capital, one of Lydia's Hilton grantees. A fantastic group. He actually had a family emergency, had to fly and leave the country. So there's a few slides, and I'm just going to show you a few of the most relevant. Andrew, you would probably be better placed to deliver this because you have the expertise in agribusiness. So, but this may be very relevant to your work. Open Capital is really looking at how to work across agriculture, small and medium businesses, early child development, and refugee. So there's a lot of Venn diagrams that cross with our work here at MMA and also the work of many of our guests here today. And interestingly, Open Capital looks at the illustrative sources of private financing, grant funding, this being impact, this being profit, and where they fall in terms of what the priority is. Grant funding is here, results-based financing and low-interest financing. Development impact bonds, which Charlotte was speaking about. Crowdfunding, impact bonds, angel investment, which is sort of small-scale individuals putting in money into activities, bank loans, and private equity. That means when a venture capital fund or another investor gets an ownership in a company. So I'm going to move to this particular. They talk about using blended finance to catalyze private financing and unlock scale. And they're looking at blended opportunities for private financing to enter ECD in lower income areas. And this is really cool what they're doing, because there are others, like Acumen did a report on employer-supported care in East Africa in 3 countries and found that it was not yet ready for debt or equity financing. So to get financiers interested to come into ECD in a low-income area is a big deal. So they're looking at outcome-based models as well as market-building approaches. Here, this is quite fascinating. This is really interesting. They are looking at sustainably building parent livelihoods in rural settings to grow ECD demand and build more commercial ECD business models. So let's say a parent earns $1,800 over the whole year. All of that earning means any kind of housing expense, consumption expense, health expense, any kind of expense has to come within that budget. So they don't have a large budget to pay for early child development services. You can generate demand of parents, but if there's no ability to pay, then what do you do? So what they're looking at is grant funding, which de-risks the entry to rural areas. Then, for your work, Andrew, this is so interesting, they're looking at large, privately funded agricultural aggregator and processor models. Then those provide agricultural inputs and training, which commits to purchasing from smallholder farmers. Then the smallholder farmer community has improved demand for quality ECD, and they have the better ability to pay for services. So then that creates more ability for youth-led or female-led businesses to start up around childcare and parents to be able to pay. And they also talk about other pathways needed, like on financial inclusion, ECD awareness raising, etc. So this is very oversimplified, and I am a non-expert on their model. But their model is really innovative and very relevant to especially the East Africa refugee context. So I wanted to share this on their behalf. So this is Reza Fazel. Like, this is one of those people that I was telling you, like in 20 years, I think he's going to get a Nobel laureate. So if you have the chance, reach out to Reza. He would love to engage with you. Lydia can also put you in touch with him. Oops, and I am going to turn it over to Arif Neki, who's going to share with us on ecosystem acupuncture and a lot of other exciting innovations.
Pleased to meet you all. Thanks for inviting me. Arif Neki, Senior Advisor, Strategic Partnerships at the UN Resident Coordinator's Office, which brings a family of 24 agencies, funds and programs, 2 global head offices, multiple regional offices together. Essentially sort of the head office of UN in Africa, within which I'm delighted that this month marks my 10th anniversary of having founded an SDG partnership platform, entirely funded by philanthropy and private sector. No UN funding, but right at the heart of UN. With the 30-second elevator speech being convening, connecting, catalyzing SDG partnerships, financing, and investments. I've just seen a sign that I have 5 minutes, so I'm going to skip through a few slides. But I'd really like to tell you a bit about our journey, and it's a bit of a case study on how an ecosystem builder can help to drive some of these initiatives and partnerships as ODA funding and aid shrinks in emerging middle-income countries like Kenya. And we need to move to what the Secretary General describes as the need for SDG funding to financing. How do you sustain your development momentum after 60 years of sweetheart grants from bilaterals, multilaterals, foundations that are now drying up? So this is a big sea change. It's a bit of a boiling frog syndrome. There's a lot of complacency. The non-profit sector has been enjoying wonderful grants, both the wholesalers and retailers in terms of community foundations, etc. But the writing is on the wall, and we've seen other countries that have been through this journey. And sometimes it's very painful because a lot of NGOs and partners have tended to collapse. So my background is I come from banking, Société Générale. I come from private sector. I ran a computer training college in Canada. I come from the Aga Khan Foundation, which I ran in East Africa for 14 years. My friend Fawad is also from the Aga Khan previously. And now the last 10 years in the UN. So my heart is in philanthropy because I have been 23 years ago the founding chairman of the East Africa Philanthropy Network, which then had 300 foundations. And more particularly in ECD, because I was very blessed to have been appointed at one point the ECDAN focal point for Kenya, when ECDAN decided to have the 7 countries that they needed legs on to move some of the ECDAN agendas. And then the Nurturing Care Framework Task Force that Oscar, my friend here, chairman of the ECD Kenya, that we co-created, set up with the Ministry of Health. I think one of the issues that I just want to say up front is we've always been in silos within these sectors, and having got across multiple sectors, I sort of felt like a bit of, I felt my job description was the silo buster. So I could sit with foundations and partners and talk about value-based, philanthropic, strategic giving, localization, etc. And then you sat with private sector and you talked about ROI, IRR, and yield, and that sort of thing. But increasingly, I realized it's more than that. It's wow, 2 minutes. Okay, so maybe I'll just basically skip everything if I have 2 minutes. $4 trillion gap. Lots of data on where the gap is, particularly in East Africa in various sectors. Our journey, which I will not talk about. Let's see. This is our focus now. We had an event at UN General Assembly in September last month. We had one at the AVPA conference last week. And we're having the last one for the European partners at Building Bridges in Geneva, second week. This is a multi-partner trust fund we created, which allows convergence and allows multiple sectors to come through a mechanism that's extremely cost-effective and transparent, which is for seed funding. This is a $2 billion aspiration for 5 years that the UN is driving, with about 17 multiple joint programs around people and peace and planet and prosperity. I'm rushing through, but feel free to catch me later. Our core ecosystem building work streams. Oops, doesn't look like it's going backwards. It's only going forwards, so. Okay, I'll just start here. So the ecosystem building is important because we created this philanthropy platform that Ford, MasterCard, and Hilton decided to create in a sort of an experimental mode in 2014 with the advent of the SDGs. And after moving on to UN from the Aga Khan, I created this platform in Kenya and moved on to help create 8 more platforms across Asia and North America and Europe. But we realized very quickly by 2017 that philanthropy is agile, is value-based, is innovative, it's all the right things, but it's not enough in and of itself. So we need to really move from, charitable giving to strategic philanthropy, health systems, education systems, all of that journey that we went through, now to becoming a player in the blended finance continuum, which really means that let's use our precious philanthropic dollars to unlock private capital. And let's use that to unlock government co-funding once you've had the proof of the pudding on your innovative approaches. So our role is really to try and keep this seamless blended finance continuum going. And there's a lot of lessons that we've learned. We've also created this whole ecosystem around Impact Investing Kenya, where I was able to chair and put together all the financing networks in Kenya for the last 5 years, and we've launched it as Impact Investing Kenya. These are people sitting in a room like this saying, we've got the funds, where is the deal flow? Where are the opportunities for the kind of financing we want to do? So you're seeing this really interesting demand and supply happening in the same country, but some kind of a structural gap that's not allowing deal flow to happen, and that's where we're trying to unlock a lot of this work. We also created the SDG Accelerator Lab with Rockefeller in 2019. We've done a fair amount of work, the Africa Venture Philanthropy Alliance. I'm the deputy chair, and we've just had our amazing conference last week. So with all of these ecosystem structures, one of the things we found was that we needed, in order to unlock not just philanthropy, but private capital, we needed market information, we need data. So the first thing I did was try and drive primary healthcare investments. And private sector partners I worked with were very cautious. They said, look, we're not sure about primary healthcare, pit latrines and that sort of thing from the old days. We focus on secondary and tertiary PET scans and CAT scans. And I've done that with Aga Khan, with the Heart and Cancer Center and Oncology Center and the like. So we commissioned a study which identified, in fact, a staggering $6 billion opportunity just in Kenya for private capital in primary health, which was really amazing. And we identified deal sizes, margins, and subsectors. Now that's the language that incentivizes private capital. Because this kind of multi-stakeholder coalition of partners in the ecosystem goes beyond the love of God, compassion, and philanthropy. It ends up with enlightened self-interest. And how do you create the incentivized win-win for every sector? So this helped us unlock $200 million of concrete primary healthcare interventions on the ground. Now, having worked with the Madrasa program at Aga Khan and having expanded the Madrasa program, which I'm sure all of you know, we were quite intrigued to think about how do you sustain the Madrasa program, how do you sustain ECD programs? And we looked at a lot of interesting, our results-based financing opportunities. I won't talk about agriculture, but we can have a side chat on some of these. How do you layer on some of your adolescent sexual reproductive health type initiatives and create a results-based framework that layers on ECD and layers on mental health, for example, rather than creating it from scratch? This example was really interesting, and we had Kois with us, we've had Julia from SIF with us, and many other partners. And what we did was we had this aspiration of 500,000 girls, 18 to 20, accessing 300 public and private facilities in 10 counties in Kenya. We created an investor window, investors who will come in for risk and return. This is not CSR, this is not the 2% on the side of the balance sheet, this is core funding. for risk and return. And we created an outcome funding window, which was mostly philanthropies, but also some bilaterals. And that allows you to essentially ensure that outcome funding will not be released until there's an independent global evaluation of impact. So the performance is funded in terms of cash flow by the private sector investors who take a risk. Once performance is verified independently, the outcome funding pool will release funding back to the private sector partners with a premium for better performance. And we've currently exceeded our targets. We went from 0 to 7 million to 12 million this year, and we're hoping to get to 20 million next year. But this just gives you an example of the type of mechanism that one could use for this kind of results-based financing. Okay, I've got 1 minute, so let me run. Let me not talk about this, mixing public and private capital on an app-based innovative insurance program. Key reflections. It's, I think, quite important now to create this multi-stakeholder convergence. My favorite saying is, let's drop our egos, logos, and silos, and let's converge for impact. Because you tend to have too much duplication, too much of the same thing happening even in one country. Scale and systems change. Let's go away beyond those little boutique pilots, which, over the last many decades in the field, I've sort of seen as puffs of excellence that die in a sea of deprivation when the grant funding dies out. Let's think about planning for scale right from inception. Let's think about curating high-impact investment and financing pipelines, because ultimately that's what hits the ground. Everything else from the UN General Assembly and the big convenings and the big alliances is hot air until you actually land an investment on the ground. Otherwise, you're not touching people's lives. So we need to keep our eyes on the ball. We need to connect the entire financing continuum that I talked about. We need to ensure learning. For example, in the Madrasa program, after 25 years, we thought we were doing amazing work, and Oscar and others with us. We were told by the Aga Khan that this is all great, this is your calling card for ECD, but where's your intellectual underwriting? Where is the research that underpins the innovations that you're doing? So we had to essentially support the creation of the Institute of Human Development at AKU that Fuad talked about, which is twinned with a similar IHD in the University of Toronto. Local skill in the game. There's plenty of capital in Africa. There's no lack of money in Africa, so don't read those news reports too seriously. What we don't have is risk capital. Capital that wants to go beyond market rates or below market rates that allow us to create that kind of risk capital. So last week we launched the Africa Fund of Funds, which is a $200 million fund to unlock $2 billion for growth opportunities in Africa for impact. And this was with AVPA, this was with CIF, it was with Prosper Africa and DFC. And we're kind of looking to capitalize this as we speak. And ultimately think about sustainability pathways. I've seen a lot of amazing innovative financing models and instruments, and they look really interesting. But oftentimes they don't have the tail end of sustainability, which means that after 4 or 5 years, when the initial pool of funding dies out, everything collapses. Which means, in my simple terms, that there are 2 pathways to sustainability. Either we create something that is proof of the pudding that can be scaled up through government, like our development impact bond in the Ministry of Health ultimately, that goes on a multi-year budget framework with government so that it is ensured to go through, and with counties on the ground who have their own planning documents, which is the CIPDs in Kenya. Or you take the other route and create a business model that has downstream income that comes back into the pool. Unless we do that, we're simply going to dry out whatever we have in the 3 or 5 year period of that project. And so we're very, in a sense, hard on ourselves to say every time we go with some of these opportunities, we would like to make sure that we have some level of planning for sustainability and get away from this disease called pilotitis. I've rushed through this, and apologies for that, but I think my time is over. Thank you.
So thank you, Arif. I think that was really brilliant in showing how a person has weaved together early childhood development across sectors, working across foundations, implementation, private sector. I can feel the questions and the thoughts and reflections pulsating in the room. But we have one last sort of a call to action. So I'm going to ask Alvin to join us.
Good afternoon, everyone. Thank you so much. And I know we've been sitting for some time. And just to pick up from the previous speakers, standing up, I want to be an example of that 3-year-old, 2-year-old child that we are talking about today, that is able to grow up to this level. By name, I'm Alvin Daniel Onyango. Currently, I'm a master's student pursuing a Master of Science in Development Finance. And that is what has really triggered me to be deeply into innovative finance, because I love problems and I love looking for solutions for those problems. Innovative finance is a big word, but how do we demystify that to people on the ground, and also how do we measure impacts to the progress on the ground in terms of people, planet, and capital, because we still need more capital that is sustainable, scalable, and that is able to commensurate with the impacts on the ground. So at the heart of everything, we are all humans, and everything should be at the basic of human rights. So innovative finance is so wide, and now we need to just see how do we move from the macro level that all speakers have spoke about to the micro level, that is the small SMEs, small holder farmers. How do we trickle that capital to them so that we can see impacts at home in terms of decent education, decent healthcare, decent caregiving? How do we also ensure that mothers who take care of us when we are still young are well taken care of? So I call up upon each and every one of you, both in development space and finance space, that we need to tailor instruments that trickle down to people on the ground. As I finish, you all know what happened in Kenya in the month of June, the Gen Z. Why? Because we finished our campus and we want to get employment, but we are not able to get the opportunities. So I ask each and everyone who is in this room that please let's tailor financing that meets the needs of the underserved and those in the remote constituents. And thank you so much, and let's keep up the conversation going. Thank you so much.
We also have Julia Greenland, who's currently with Healthy Brains Initiative and formerly part of this SIF, getting all this co-conspirating going on, and now doing some fascinating work in mental health, another innovative finance instrument that you'll hear about later. So we've had a full hour of action-packed education. And if God was bountiful to give us another half hour, we would delve into our walking, talking activity, which Fawad has introduced, and we would delve into burning questions. But to keep with the time, what we're going to do is first, I'm going to give you about 1.5 minutes of silence, where you can look at your sheet, fill out your sheet, and then what we'll do is you can bring your sheet to Fawad and to myself, and during the break, I'm going to ask you to please, if you have burning questions, come to our table where our presenters and our guests are all gathered here. We can address any burning questions during the break. And if you would like to get into a deeper conversation, roll up your sleeves and talk about what do we do about all that we learned about in the last hour. And please, right at the end of this session, we'll have an informal session, maybe here at this table, and we will. Anyone who wants to talk about innovative finance, please join us right at the end of the session.